April came to see Dr. Pixie about unsightly thread veins on her leg.
So April, if you want to roll the trousers up for me, and let's have a look.
She has been referred to Mr. Constantinos Kyriakides for a series of injections that will relieve her problem.
The plan today is to proceed with what is known as micro-injection sclerotherapy, which is the use of a special chemical that is injected in the vein and causes the vein to effectively shrivel up, and then it disappears. Do you see that?
Yeah.
You impressed?
Yeah. Wow.
How about this one? Now you see
That's
how the...
making me fill up.
Really?
Sorry.
That's okay. I know you've suffered with this for a while now.
It just looks too different. It's amazing.
After the first session of treatment, the intricate technique has been successful.
Now, what we used today was fibrovane, and what it does, it actually inflames the inside wall of the vein and makes the vein effectively clot off or occlude. And because the vein is then, for lack of a better term, dead, it gets absorbed and then disappears from the skin or the underlying tissue and no longer shows.
During the sclerotherapy procedure, Mr. Kyriakides has discovered that she has a more serious underlying problem in her left leg and has asked her to come back for further treatment.
I found that the valves in the main superficial vein in the leg were not functioning properly.
This means she will need to undergo a procedure called endovenous laser ablation under local anaesthetic to close off the leaking vein.
You've got a couple of veins down here, okay, which are stemming from the main vein, which are slightly too big to inject. So what I'm going to do is I'm going to mark them and I'm just going to take them out under the same local anaesthetic, okay?
Mr. Kyriakides uses an ultrasound scanner to locate the veins feeding into the leg.
So now what I'm looking at is the junction of the vein that's causing the leak to the main vein. So this is how far up I want to be in terms of sealing the vein. I'm not going to be working up here, I'm going to be working down here. But the laser fiber, I'm going to thread all the way up to the top of the groin. And that's what I'm marking out there, the junction. So the laser fiber, when it starts working, it will seal up the vein for me from the top all the way down to where it comes out. Okay? So that is why we no longer need to be, with this technique, we no longer need to be making a cut in the groin. For your left leg, we know that we've got two types of problem. One is the visible veins that you have under the skin, but also the vein that runs underneath the skin, which is a bit deeper, but visible with ultrasound, which is effectively leaky. The valves in that vein are leaky. So what is happening is that the blood is pulling down into the leg as opposed to going upwards, and that is the reason why you're getting the more superficial veins in the skin visible. So what I've done so far is to mark the course of the vein, the offending vein. Okay, having prepped the leg, I have put some Embla cream, otherwise known as magic cream, on the skin, and what that does, it actually numbs the skin a little bit, because this procedure does involve a handful of injections through the skin.
Then he uses the ultrasound scanner to work out an entry point for the laser fibre and inserts a sheath into the vein.
It's meant to feel good.
Yeah, it is. It's not uncomfortable, it's not painful, it's fine.
This is the laser fiber, okay? This whole thing is a laser fiber that would be running inside that sheet I showed you. And the tip of the laser fiber, this bit here, is the active bit. That's the bit that actually seals off the vein. Okay, and it's got a little light that guides us through, as it were. And you can see it kind of running up the skin, underneath the skin.
A fluid buffer is then put down the vein to help numb the inside of the leg.
Fluid is going in now.
And compresses the vein onto the laser fibre, giving it a better contact and also helps to reduce bruising.
How are we doing, April?
Fine, I'm fine.
Once the laser is fired, I slowly pull back the laser fiber at a set rate, and that seals off the vein along its course.
To clear up the smaller veins, Mr. Kyriakides performs a procedure called a phlebectomy.
Phlebectomy is a procedure whereby one punctures the skin over the offending vein and then uses a crochet hook to pull the vein up and effectively just rip it out. All finished.
Nine weeks later, April is back to update Dr. Pixie on her progress.
Let's see these legs. They're pretty good, aren't they?
Yeah, and I think once the bruising's gone, it'll be even better.
All around here, you were covered in these very, very fine veins, and it's just gone.
Yeah.
It's amazing, isn't it?
Yeah.
Just disappeared.
Yeah, it's really good.
So there's lots of things you can do now that you couldn't do before.
I'm looking forward to going on holiday and try my new legs out.
For the first time in 10 years?
Yeah.
Good girl.
Yeah.
So, April, enjoy being pain-free and, most of all, enjoy the summer.
I will do. Thank you.
You're very welcome.
Thank you.